Today, I want to start with a bit of breaking news. You've probably heard already, but the other day, journalists at BuzzFeed got their hands on a bunch of private emails to and from Dr. Anthony Fauci throughout the last year. They were able to get these because of the FOIA Act, the Freedom of Information Act, which essentially says that you can put in a request for government emails and government information. There are some restrictions to that. If it, you can't endanger somebody, you can't dox anybody, and it can't have implications towards national security. But other than that, you can pretty much get your hands on. Not whatever you want, and I guess the process to do that is pretty annoying, but you can do it if you want. So the emails they found, they got over 3,000 of them and published the entire thing. They published all of it, and you can go check it out. I will put a link in the show notes, but there are, 5 specific emails, 6 because one of them's a two-parter, that I wanted to go over. And of course I don't have it pulled up because I'm a dumb idiot. Let me just pull it up quick here. Here we go. You can find it on Document Cloud, and then you can just download the original PDF, and it'll take you literally right to it. So the first one I want to talk about is his internal emails about how to treat COVID-19 if you get COVID-19. Essentially, there was some confusion, and the way they said it in public is a lot different than the way they were talking about it in private. They were withholding information, not just with treatment, but with everything. They were withholding treatment information. They were withholding mask information. They were withholding the fact that Anthony Fauci has been involved in different laboratories that do different sort of editing research on viruses, gain-of-function research. It's all there, and it is pretty wild. There are members of Congress, specifically Rand Paul, who are calling for his firing, which is kind of crazy. Let's get into the first email I want to talk about the treatment email, number 1316. Okay. So the first email is from a Marine to Anthony Fauci, talking about a treatment for COVID-19. It essentially is an oxygen therapy treatment that I haven't heard of it ever. Basically, it was used in the Spanish flu of 1918. It is a breathing high purity oxygen, 92% or higher, for 60 to 90 minutes in a pressurized environment. It is when this email was sent and the date this email was sent, it doesn't actually have it on there, which is kind of cool, I guess. Not really. It's kind of stupid. There's a lot of redactions in these emails that some of them are kind of sus. Like, there was one, I can't remember which one it was, but there was one that was like an analysis from a scientist about some sort of having to do with COVID-19, and I don't know what they were analyzing. I know it's wrong. Analyzing is the word. Fuck off. I don't know what they were analyzing. Because it didn't say. The whole thing was just taken out of the email. It just said, please analyze, thanks, and then the rest of the email is just grayed out. So there's a lot of that in here. Obviously, there's like names that are redacted and like phone numbers and stuff, obviously, but some stuff that I think shouldn't be redacted there's a lot of this. It was some sort of Navy operation where a 12-seat chamber is used for this oxygen purity treatment, I guess. It's supposed to increase lung function, blood oxygen level recovery, unlike respirators, which is another email I want to get into, because there was a lot of mainstream cable news coverage that was all about respirators, and we didn't have enough respirators, and then respirator, right? But it turns out that respirators are not as good of a treatment. It should be used as an absolute last option, because when you're on a respirator, your body is relying on that to breathe, and I guess the way I understand it is once your body gives up breathing and the respirator takes over for you, it is extremely difficult for your body to re-breathe on its own. But that's all you heard about in the early days of the pandemic, was like, we don't have enough respirators, they're not made here, we need to make them, this and that. But they knew, like, there were internal emails in like March and February talking about this stuff, but it wasn't shared properly with the public, which is a big thing. The next email is the gain of function one, 3206. So this is from Fauci on the 1st of February in 2020 to a scientist named Hugh. I don't know how to pronounce his last name, so it starts with an A. If you want to look at it, you can. It's page 3,206 out of 3,234 if you find the emails. So it says, the paper you sent me says the experiments were performed before the gain of function pause, but have since been renewed and approved by the NIH. Not sure what that means, since Emily is sure that no coronavirus work has gone through the P3 framework. She will try and determine if we have any distant ties to this work abroad. Apparently that was sent from Fauci. So around the time that the lab leak theory, at this point in February of 2020, was a complete conspiracy theory. People, there were legitimate researchers and scientists who were talking about how the way the virus acts is not, it doesn't seem natural. And there were a bunch of people who discredited them immediately, pretty much canceled them, to use a better word, in today's context, but wrote them off as conspiracy theorists, didn't take them seriously, even though they were like legitimate scientists. But it turns out in February of 20, Big Fauci was talking to someone with concerns that there were experiments being done before the gain of function has been shut down, which is kind of interesting. You can even go back to there was like a clip that aired of a committee hearing in Congress where Rand Paul was arguing with Fauci about the gain of function research.
Dr. Fauci, do you still support funding of the NIH funding of the lab in Wuhan?
Senator Paul, with all due respect, you are entirely and completely incorrect that the NIH has not ever and does not now fund gain of function research in the Wuhan Institute of Virology.
Do they fund Dr. Barrick?
We do not fund.
Do you fund Dr. Barrick's gain of function research?
Dr. Barrett does not doing gain of function research, and if it is, it's according to the guidelines, and it is being conducted in North Carolina. You
don't think inserting a bat virus spike protein that he got from the Wuhan Institute into the SARS virus is gain of function?
That is
You would
not
be in the minority, because at least 200 scientists have signed a statement from the Cambridge Working Group saying that it is gain of function.
Well, it is not. And if you
So I will never, I guess this is the first time ever that I have agreed or will agree with Rand Paul. I don't like his politics. I don't like his culture war bullshit. I think he's whack. He's one of those fucking free market libertarian, the market can do no wrong, the market is everything, yada yada this, yada yada that, small government, stay away from me, 1980s era Reagan politics, fucking we know doesn't work. that's Rand Paul. But in this specific instance, I agree with him that, or I guess I have some sympathy for him, because when you heard when that I can name a bunch of news articles and a bunch of segments that I watched that said Rand Paul was like reaching for straws, and Fauci said that they never do any sort of gain of function research, and it's never been funded by the United States, and this and that. And people were pissed off at Senator Paul for even thinking about that and even bringing it up. Well, turns out that he had good suspicion, and it turns out that Dr. Fauci lied to Congress, and is he going to get punished for it? Probably not, because anybody in power can lie to Congress. That's fine. The next one is hydroxychloroquine. This one is probably, other than the gain of function research, this one probably strikes me as the most appalling, because, wait, which number is it? 153, not 123, 153. Because when Donald Trump was in office and he was talking about hydroxychloroquine being a good treatment for this, because Trump was the one who said it, it was automatically discredited, right? It was automatically discredited as wacko, as pseudoscience, as a treatment that doesn't really work. It's a malaria drug. Why would it work in this case? Don't take it, this and that. There was a lot of politicization over this treatment. Well, it turns out that in February 29th of 2020, there was a email sent to Vice President Pence, and Fauci was on this email as well, from it, the whoever sent the email is redacted. We don't know who sent it, just their email address was redacted. There was a Paul and Carol Stanton, they're doctors, wrote a letter and sent it to the president talking about how this treatment, the drug called hydroxychloroquine, has been widely used for 70 years, is an antiviral drug, and they think it might be a good medicine. They say, use this. This will work. It says, we realized this could be a very good drug for the use of treatment of high-risk patients infected with COVID-19, and help their progress in hospitalization and their need for ICU care. It's an antiviral drug. It has been given, it's given orally. It's cheap to use, or it's cheap to produce. It's readily available. Low doses, like 6.5 milligrams, have been affected in managing different respiratory issues. A low dose of hydroxychloroquine could work for high-risk patients, for chronic, with people at higher risk, people with pneumonia complications, hypertension, diabetes. It might help prevent the development of pneumonia. I'm just reading from the email, from the letter that they sent to the vice president. They have attached several articles with electronic publications made available February 4th and 19th of 2020 in scientific journals. But of course, those are redacted out of there, out of the emails. I guess the government did not want us to see that, but they'd let us read this whole fucking email, but they won't let us see their sources. Okay, cool. But these doctors called it in early February that hydroxychloroquine is most likely a good treatment, but because Trump said it to the public, it was completely written off, and it turns out now that they were talking about it in early February. And then I guess it turns out that it does help in certain situations. So maybe if we didn't politicize a fucking disease, we could have saved a whole lot of more lives. It's just one of those things. The last one is, there's two more. Let's do the pharmacists there. So there was a group of pharmacists that wrote an open letter talking about masks and the use of them. Let's pull this up here, 2778. So a bunch of pharmacists signed on to this letter about masks and then sent it to Fauci. It says, essentially, surgical masks are for patients without symptoms. They discourage. There's no evidence that they help. They're too loose, and the virus can slip right through. So essentially, if you don't have any symptoms and you're wearing a surgical mask, you're not doing anything. Nothing's happening. It says, clear up any confusion about masks. Underline, emphasize that masks are for sick patients to help their germs from getting into the air. That we know. That was publicized very early on, but then they told everyone to wear one because you could spread it even if you were asymptomatic. Well, this letter from pharmacists is saying, actually, no. If you don't have any symptoms, you probably don't need to wear a mask because it's not going to do anything. N95 masks are more fitting. It says, if patients ask about N95 respirator masks, tell them these require fitting and training before use. Save them for healthcare workers. That one was publicized way later. Like, I want to say, God, when was that public? It was this year. It was early this year when we found out that the N95 masks are really not for everyone. And there was a huge mask shortage, a huge N65 shortage at the beginning of the pandemic, if you remember, because everyone was going out and buying those masks because we knew that they were the best available. Well, there was a group of pharmacists on February 11th, 2020, that sent a letter to Fauci saying, hey, don't tell people to buy these, save them for healthcare workers, but nobody said anything. Let's see. It even says unnecessary mask use will contribute to shortages. I mean, it was all here. Like, it's so fucking stupid that the way it was all politicized. It's insane. And in this letter, too, it also talks about respirators, about how they're not really the best for people with COVID. It should be a absolute last cause because more people will die on a respirator if they are put on a respirator too soon. So yeah, big news, big development. Over 3,000 emails were taken, not taken, they were rightfully given to journalists, because of the Freedom of Information Act. And now we know that probably a lot of lives could have been saved way earlier in the pandemic if, our government officials just, acted like adults, and not worrying about what the other side is going to say